Good afternoon, everyone, and welcome to today's webinar, Introduction to Functional Behavior Assessment and Behavior Intervention Plan, training co-sponsored by Peak Parent Center and the Colorado Department of Education. My name is Pam Christie at Peak Parent Center, and I'll be monitoring the chat throughout the training. We understand we're having some technical difficulties, so this recording will be sent to all participants. It's my pleasure to introduce our presenter, Bill Brown from the Colorado Department of Education. Take it away, Bill.
All right, thank you. Well, I am the Affective Need Serious Emotional Disability Specialist for the Colorado Department of Education. I am a school social worker by training, and I worked in schools for 13 years prior to coming to the Colorado Department of Education. In addition to working in schools for 13 years, I also worked in community mental health centers for 12 years as a clinician or as a therapist. And so I've got a very strong mental health background, and I also have a very strong behavioral background. I was certified as a behavioral specialist for the developmental disability population and the traumatic brain injury population. And so I've been doing behavioral programming. I've done it in nursing homes. I've done it in hospital settings. I've done it in acute treatment facilities, group homes, independent livings, and in the school environment. So as we go through this webinar, we're going to talk about understanding the functional behavior assessment and behavior intervention plan. I would encourage, if you have questions, to feel free to put them in the chat, or my contact information is on the last slide where you can email me the questions if you would like, or give me a phone call. So this webinar is going to be a two-part series. The first part is going to talk specifically about a functional behavior assessment and behavior intervention plans. And then we'll have time to talk about what it might look like in the home environment. With part two, we're going to talk about the manifestation determination review process. And we're going to talk about when students get removed from school. We'll talk about formal and informal removals. So our outcomes of this first part is we want participants to understand what is a functional behavior assessment and what is a behavior intervention plan. So we're going to start with that functional behavior assessment, which is abbreviated FBA. So a functional behavior assessment, this is the process of collecting information about behaviors of concern for a particular student. So it's collecting a body of evidence over time. Then you're going to analyze that body of evidence and look for patterns in the different behaviors. And then once we have those patterns established, then we'll build our behavior program around those patterns. So when we're talking about behaviors that you might do a functional behavior assessment on or with, it could be academic behaviors, it could be a social behavior, it could be emotional behaviors. So there's a wide variety of different areas we can apply a functional behavior assessment. So first, we're going to start with behavioral theory. So behavioral theory is rooted in this context that all behavior is functional. It's predictable and changeable. Understanding the function is what helps us develop that behavior intervention plan. Knowing the function is knowing the purpose of the behavior. Another way to think about it is we all benefit from our behaviors in some way, shape, or form. We all get something from those behaviors. Otherwise, we would not engage in those particular behaviors. And so instead of guessing in the dark, understanding the function helps us to develop replacement behaviors that serve the same function so they can get their needs met, but only if behavior that's more socially acceptable. So we're looking at the behavior, the function of that particular behavior. Other thing about behavioral theory is all behavior is considered to be situational, meaning that it's related to the environment that you're in and the environment that you're functioning in. So when you have a different environment, the behaviors are as a response to something in that environment. And as a result, we all have different behaviors in different environments. We behave differently in the community than we do in the home environment, than we do at school, or maybe the work environment. If you're seeing behaviors that are happening in multiple environments, such as home, community, school, then that might be an indication that you're looking at some kind of disability, because the behavior is no longer situational in nature because it's crossing multiple environments. The other aspect about behavioral theory is that behavior is learned. And if behavior is learned, That's very hopeful because that means we can relearn new behaviors and we can go through new behaviors when we're doing that. So just kind of a behavioral theory kind of in a nutshell, that it has a purpose or a function, it's situational in nature, and I forgot the other point, but that's okay. Situational in nature with that. Okay. So when you look at any questions about behavioral theory real quick. All right. So when we're changing behavioral problems, we want to understand that behavior problems do not occur randomly, that there are events that are connected to that, and that there's a function or purpose to every one of those particular behaviors. What can make behavioral programming challenging for school staff or even in the home environment is one problem behavior can have multiple functions with that. So you can have multiple functions. An example of a function might be they're engaging in that behavior to get attention, or they're engaging in that behavior to escape or avoid some kind of undesirable task. And so, in the same context of one behavior, you might see a student that starts off with trying to avoid a task, but then likes the attention that they're getting. And that's why behavior programming can be challenging or gray. A lot of times we want to make it black and white, and it's just not black and white because people are very complex. And so it's usually that gray. To change the behavior, the intent or purpose of the behavior must be understood. Just as a general rule of thumb, takes about 1 month for every year that a behavior has existed. And this comes from Dr. Laura Riffle, the behavioral doctor. And so I just put this up there to let people know or communicate that when you're doing behavioral interventions, it's not a quick fix. It's not an overnight fix. It's going to take time for that behavior intervention process to work. So if you have a 10-year-old student and they've been engaged in negative behavior for 6 years, that's going to take 6 months of behavior programming to kind of get them back on track. So just to put that kind of in scope to understand this is not going to be a quick fix. The other thing we need to take into consideration when talking about changing behavior is an extinction burst. And so what an extinction burst is, it means the behavior will always get worse before it gets better. So what has happened is this child or the student has acted out a very small amount, and that gets them exactly what they want or get their needs met. We put a behavior program in place, and then acting out doesn't get their needs met anymore. So they're going to act out a little bit more to see if that gets their needs met. And then they're going to act out a little more and see if they're going to get their needs met. And they keep acting out more and more until they either get their needs met or until they figure out that the acting out behavior is not going to get them what they want. So we want to make sure when we're putting behavior programs in place that we keep the behavior program in place through that extinction burst. If we don't keep the behavior in place through that extinction burst, then kind of what we've done is we've taught them they can skip all the small behaviors and go straight to that big behavior to get what they want with that. So we really make sure that we, going back to that 1 month for every year, that we're allowing enough time to get through an extinction burst. And so sometimes what happens is you put a behavior program in place, people think, oh, the behavior's getting worse. We must not be doing it right. That should be your first clue you're on the right track, and you don't want to stop that until you've got through that extinction burst. FBA kind of provide the following information for people. They identify what behaviors are challenging in observable and measurable terms. And what we mean by observable and measurable, if I say the student is avoiding work, there's lots of different ways a student can avoid work. They could avoid work by pulling their hoodie over their head. They could put their head down on their desk. They could crawl under the desk. They could leave the classroom. There's lots of different ways a student might avoid that. So when we say observable and measurable terms, we want to be very specific on that behavior. So we would need an operational definition that would say the student avoids their classwork by putting their head down on their desk, not talking to the teacher, not responding to any questions or communication. So you'd want to make sure that it is there. Measurable means we need to be able to count how many times that behavior happened, how many times they put their head down, or we could count how long they put their head down for, or we could count how long it takes them to, if we gave them a math worksheet, how long does it take them to do that? So there are different ways to measure that. So we just want to make sure it's observable and that it's measurable. And what they're looking at is what they call antecedents. Antecedents are the triggers to the behavior. They're what happened right before the behavior in the environment. Examples of an antecedent might be a teacher asked them to do something they didn't want to do. They asked them to stop doing a task they like doing. It might be that a peer made a negative comment to them or gave them a funny facial expression. So antecedents always precede the behavior. And then we're going to look at the consequences for those behavior. The consequence just means, what do they get from that behavior? When you're talking about consequences from a behavioral terminology, it can be positive or negative. In this case, it just means, what do they get? How do they benefit from that behavior that they're engaging in? And then setting events. Setting events are what might predispose that student to make the problem worse or more likely to occur. An example of a setting event might be, I come to school tired, or I come to school hungry. And if I'm tired or hungry, that might make me more likely, when a teacher gives me something to do, to shut down with that. And so usually we follow this kind of format when we're talking about behaviors. We start with the behavior part, and what does the student do? What is the behavior that we're looking at? And then we go to that antecedent that I just talked about. What happened in the environment that kind of triggered that behavior? And then next we look at the consequence of that. And the consequence is just being sure what the impact is with that and what they're getting out of that piece. Do I have something in the chat? No. Okay. The setting events, it kind of predisposes them. Usually the setting events will happen outside the context of the school environment. They might be a diagnosis of depression or a diagnosis of anxiety, maybe a past history of trauma. It might be that they didn't get their medications on a particular day. And so that sets them up or makes them have less tolerance, so that when the trigger happens, they engage in that behavior and have that outcome with that. And then normally here I'd ask, does anybody have any questions about the difference between setting events and triggers? Because that can be kind of maybe hard to, or a little bit gray to figure out the difference between setting events and triggers. That can be a struggle sometimes. Does anybody have questions about that?
Bill, I do have a quick question. I was just wondering about school resistance altogether, and is that where does that fall on this spectrum?
Okay, that would probably be a setting event. So if they had a history of not doing well in school, or a history of not liking school, that would be a setting event. So that would predispose them when they go into that classroom to already be defensive or on guard against that. So having that history would be a setting event. And who's going to have the best information on those setting events? The parents are going to have the best information on the setting events. Parents are going to know better than anybody else what those setting events might look like. Parents are also going to know what the triggers might be or what behaviors that there might be looking for. So who is responsible for conducting a functional behavior assessment? So within your IEP team, it can be anybody on your IEP team that is trained to conduct a functional behavior assessment can conduct that functional behavior assessment. Generally speaking, it might be a mental health person or a special education teacher that's in charge of that functional behavior assessment, making sure that they get everything done or all the parts and pieces are get collected. However, a functional behavior assessment should be a team process and not an individual process, which means that you might have one person in charge of collecting that information, but they might have the general education teacher collect some information. They might have an administrator collect some information. They might also collect information from parents or guardians and include them in that process. Anytime they're doing a functional behavior assessment, they should really include parents in the gathering of that information, because parents are going to have the best information on that particular student. So they really should do that. And there are a variety of different instruments they can use to collect information with that. And so really it just comes back to who is trained and who has the skill to collect that information. In order to do a functional behavior assessment, according to Colorado law, parent permission is needed or required in order to conduct a functional behavior assessment for a particular student. The very bottom bullet point is the actual regulation. School personnel shall not test or require a test for a child's behavior without prior written permission from the parent or guardians for a child and prior written disclosure as to the disposition and results of that. So that means that if they're going to do a functional behavior assessment, they have to let the parent know. They have to explain to the parent what is a functional behavior assessment, and they have to explain to the parent what are they going to do with the results, what's going to be outcome or the use of that information with that.
Bill, I have a question
Okay.
in the chat. What kinds of events would trigger the need for a FBA? Do students already need to be on an IEP?
That is a great question. Students do not need to be on an IEP in order to have an FBA or a functional behavior assessment completed. With that, you can complete this in the general education environment or general education setting. With that, here in a minute, we're going to talk about the different types of functional behavior assessments. We have a brief FBA, a full FBA, and functional analysis. Your brief FBA is most typically done through your MTSS, RTI, PBIS process in your general education setting, where they're collecting a smaller body of evidence and they're kind of problem solving or putting that interventions in place. The full FBA is normally what's associated with your IEP process with that. So when in your IEP process, that's when you're going to see that full FBA. And that means you're collecting a larger body of evidence. With the full FBA, you're looking at multiple interviews and multiple observations with that. Your functional analysis is about if you have somebody who's highly skilled, they may be doing some more in-depth aspects with that. And I could talk more about that when we get to that slide. So the regulations would say that best practice is what they call positive behavior intervention support. Best practice is anytime you see a pattern of behavior, you should conduct a functional behavior assessment as it relates to those best practices. As far as the regulation is concerned, the only time it's required, where it's not optional, is with that manifestation determination review process, which we're going to talk about in our second webinar, and that's when it's required. Is that helpful? Okay. So parent permission can be done in different ways. Sometimes if they're in your general education process or your MTSS, sometimes parent permission is done from a form letter. They send a form letter home that just says it's on school letterhead. It says what an FBA is and what you're going to do with the results, and parents can sign that and give the school permission to do the functional behavior assessment. If they already have an IEP or if they already have a 504, then the general recommendation is that they would use the permission to assess for the IEP or the 504 paperwork, that they would use that paperwork in order to get permission to do an FBA or BIP. Keeping in mind that Colorado is what they call a local control state. So every school district has different policies and procedures. Some will use the IEP process, some will use the form letter. The important part is that they have to have that parent permission piece and that parent permission signed. So how is the information gathered? There are different ways that we gather information for our functional behavior assessment. They might do a records review, and a records review might include any outside assessments. So if a parent has brought in a doctor's assessment or their clinicians or therapist assessment with that. So reviewing those educational records also includes anything they bring in from the outside from parents. So this is important because the more information the school has, the better decisions they can make. They're going to do interviews with that. With the brief FBA, they may only interview the child or the teacher, the student or the teacher. With a full FBA, they're going to interview at least one teacher, if not 2 or 3 teachers. They're going to interview the student or the child, and they're going to interview the parent, either one or both parents. So if you're doing a full FBA, part of that process is interviewing the parents. They might have some different rating scales or questionnaires that they send home. Some of them might be on social development or social histories, or how do they get along with other students or their neighbors or their siblings, cousins. With that, they might do something more formalized. You might hear the terminology of Connors or a Basque, and they're looking at different types of behaviors that would be in that. And then they're going to conduct observations. A lot of the information comes from the observation piece. And when they do their observations, they're going to go back to that ABC format or that slide I showed earlier, where it talks about what is the behavior, what is the antecedent, the consequence, and the setting events. And that's what they're going to gauge their observations around with that. When doing a brief FBA, they might do 1 or 2 observations. When doing a full FBA, they need to do a minimum of 2 observations, and they have to be in different settings, and they also have to be by different people. They want to make sure they're looking for something called interrelator reliability, making sure that we don't have a bias. We all have biases, and biases are just things that we have different views on life. With that, even if you think about student discipline, we all have different views or different understanding of what student discipline is. So you want to make sure you have multiple people in that observation. This we already kind of talked about. Is there a law that requires a functional behavior be done? And there is. Anytime you have a manifestation determination review process, you're required to do a functional behavior assessment. And the manifestation determination review process, this is really for students who have that IEP or students who are on a 504. And after being removed for a 10-day time period, then what if they have an IEP or a 504 after 10 days of removal, or they're being suspended or sent home from the school environment, then they have to have a meeting the next time they want to take any type of disciplinary action. Kind of the purpose behind the manifestation determination review process is to ensure that the student is not being punished for their disability. And so they have a meeting, and the parents need to be invited and participate in this meeting. And at this meeting, parents can invite outside agency, an advocate or a therapist to come and participate in that process as well. They make a decision as to whether this behavior is or is not related to the student's disability. If the behavior is related to the student's disability, then they would not be able to apply the student discipline process, or they couldn't suspend or expel that particular student. Best practice recommends they start this process at 10 or 5 days, but most schools will wait till 10 days to go through that. So when they get to that meeting, one of the questions they're going to ask is, was a functional behavior assessment done? And is there a behavior intervention plan? If there's not one, then they would do one at this point in time. Here are the 3 different levels of FBAs that we talked about earlier. That brief functional assessment, which is usually done in your MTSS, RTI, PBIS process. Your functional behavior assessment, which is done in your IEP process, or your functional analysis. In order to do the functional analysis, you have to have an individual. They sometimes refer them as BCBAs, or a board certified behavior analyst. They have highly specialized training and went to school to really study that behavioral piece. It doesn't always have to be that BCBA. It could be a mental health person who is highly trained and has a lot of skill and background in it. And with that functional analysis, they might move different items or figure out if they have different triggers, produce different behaviors with that. So just know that there are 3 different levels that they could be done, but regardless of the level, they still have to have parent permission to do the functional behavior assessment. So this next slide just talks about all the different parts of a functional behavior assessment. We're going to identify the behavior. And so that's going to be a matter of prioritizing, because if you have a student that has maybe 8 to 10 behaviors, from a behavioral perspective, you're only going to program for 1 or 2 behaviors, 3 at the most. And so you have to prioritize which behaviors are we going to focus on, and understand that we're not going to try to fix all behaviors at one time, but we're going to focus on that. So we want to identify what behavior, and we need to create that operational definitions. We want to collect data on that behavior, and that data is how many times does that behavior happen. So you're doing frequency data, or its duration data. How long did that particular incident last? Or you're looking at what they call latency data. Latency is all about if I gave them a set of instructions, how long does it take for me to follow up with those instructions? So you want to take measurement on that behavior. When you think about reading and writing and math, they have lots of benchmarks that help them. Sorry, I think I have some animation in the background of my PowerPoint, so it advances before I want it to. When you think about reading, writing, or math, they have benchmarks that say a student who is this old should be reading this many words per minute, or a student who is this old should be reading or should be able to do this many math problems. In the world of behavior, they don't have that data or those benchmark pieces. And so the reason they collect data is so that I can do what they call baseline data, which is collecting data without that intervention in place. And then that becomes my benchmark. So when I put my intervention in place, I can look at whether or not the intervention is successful or not successful. So if you collect baseline data, within 3 weeks, you should know whether or not your intervention is being successful or not successful. And so that just helps you know where we're at with that. And that's why we collect data on the particular behaviors. The function is, that's the purpose of the behavior. That's the why they're engaging in that behavior, how they're benefiting in it. And then from the FBA, we're going to generate either a summary or hypothesis statement, and that is what we'll use to create the behavior intervention plan. Then we're going to look at replacement behaviors and desired behaviors. So replacement behaviors are how do we eliminate the immediacy of the crisis? And the desired behaviors are what new skills should we teach the student? Because something that's very important in this behavioral process is if we want them to behave differently, we got to give them a different skill set, teach them how to do different things. And so it's not enough to simply say, I expect you to engage in this behavior, but you have to directly and explicitly teach those skill sets to the student and give them that new skill sets. And it's going to take time for them to learn those new skill sets. Then we want to have strategies. Strategies are usually for teachers, and it's different ways teachers can interact with the student to prevent the student from being triggered or prevent that cycle from being engaged. And then contextual fit is kind of an important concept. Contextual fit is all about making sure that we write the behavior program so that it's culturally relevant to the student, culturally relevant to the family, that it's also relevant to the teacher. I can speak from my personal experience coming from the mental health world and the school world. I wrote really complex behavior programs that didn't get implemented because I didn't take into consideration the teacher's skill or the resources that were available. So contextual fit is all about making sure it really matches the student, it matches the school, it matches that environment, so that we're not just kind of getting lost in that behavioral world, but we're taking into all consideration the classroom, the teacher skills, and the cultural setting. When we talk about function of behavior, there are different ways to look at the function of the behavior. Some people might say sensory is a function of behavior, meaning I'm not getting enough sensory input, or I've gotten too much sensory input, and I need to have a quiet space to get rid of sensory input. If you look at positive discipline, they would say a sense of belonging should be a function of that behavior. Do they feel like they have a connection to that classroom, or they feel like they're part of that classroom with that? And so, or do they feel like they're an outsider to it? It might be to initiate social contact. I want to get attention from other people. It might be to escape or avoid tasks or works or interactions with other people. Or it might be to obtain different objects or events. If you look at the world of trauma-informed care would argue that emotional regulation should be considered as a function of the behavior, where if the student has not learned to regulate their emotions, the behavior might be driven by that emotion. And in that case, we need to look at those emotional feelings. Another functional behavior might be maybe they don't have the skills to do it with what we're asking. And until we give them a new skill set, we're not going to see new behaviors. If you look at this from a very puristic behavioral model, your people who are functioning in that pure behavioral model would say that there are two functions of the behavior, which is to get or obtain, or to escape or avoid things. And so if you've got somebody who's kind of really invested in this model, they're going to kind of bring it down to escape or avoid. But even with sensory, you could say I'm trying to get sensory or avoid sensory. Even with emotional regulation, you could say I'm trying to become more emotionally regulated, or maybe I'm trying to become hyper aroused. So you can still bring it back down to these two functions. Although I encourage people to kind of expand it to a larger set of functions, just because I think it helps understand the student better than just simply to get or obtain. So this is a picture of the crisis cycle. And so when you're talking about a functional behavior assessment, the real goal is kind of to describe this behavioral cycle is kind of what the goal is. And so the goal with this function is it starts out with calm, where we all kind of walk into their calm. And then you have that antecedent or that trigger in the environment. And once they're triggered, they have what they call low-level behaviors or agitation with that. And that low-level behaviors might come with feelings of frustration or feelings upset. So those low-level emotions. And then you usually have acceleration behaviors, where those behaviors are accelerated. And those are your mid-level behaviors, where their anxiety has not been resolved. And so they're continuing up the scale. Then you have the peak behaviors. The peak behaviors are really the acting out behaviors. This might be that extreme behavior of throwing a chair or jumping over a desk with that. And then you have de-escalating behaviors. And your de-escalating behaviors are all about how do I know the student is calming down or your child's calming down? How do I know that that anxiety is resolving and they're beginning to re-regulate their emotions? And then recovery, that's the step that gets forgotten a lot. Recovery is about how do I put the student back in the classroom, and if the student is embarrassed or maybe feeling bad or guilty about their behavior, it's how do I get them back in the classroom so they're not embarrassed, so they're not feeling guilty, and how do I help them rebuild their relationships and reconnect to their teachers and reconnect to their peers in that. And so we built this behavior cycle into the behavior intervention plan. And the hope is that when we're doing behavior intervention plan, that we'll have interventions all along this continuum. Interventions for staff at the trigger, at the agitation, the acceleration, the peak, and the de-escalation, and even a plan for recovery for particular students. If we look at trauma-informed care for just 1 minute, trauma-informed care would say that students are probably going to walk into that classroom at either an agitated or an accelerated level, and they're not going to walk into that classroom at the calm level. Trauma-informed care would call this hypervigilance, where they're kind of looking for where danger is going to come from. And in these particular cases, when they're coming that agitated or acceleration, that's when a teacher might say, well, I didn't see a trigger, or they went from 0 to 60. It's because they were already in the middle of that cycle when they came into that classroom. And so they would say that in order to teach students, we have to bring them back to calm. Because if you look at some of the neurosequential models or the how we learn models, they would say that in order to learn, we have to be calm. And so we have to bring them back to that calm state. So the FBA is really trying to describe what this cycle looks like for that student. So what is the role of parents in this process of conducting a functional behavior assessment? Again, the parents, you're the expert on your student. You know your student better than anybody else does, and they need to have your information. You know what interventions have been tried in the past and have not worked. We don't want the school spending a lot of time putting an intervention in place that the parents already know does not work with that. So you can share what interventions have been done in the past, what works, what does not work. You can share what works in the home environment as well, and what strategies have worked. You're also going to have good information on where the behaviors happen, when they occur and whom they occur with. So parents are going to be a wealth of information as it relates to this functional behavior assessment process. So now we're going to jump quickly to behavior intervention plans, unless there are any questions about the functional behavior assessment. All right. So behavior intervention plans, usually when I train staff, I tell them that sometimes staff think that a behavior intervention plan is a set of instruction for the student, so the student can do things differently. That's not true. That's not the case. A behavior intervention plan is a set of instructions for school staff. It's so that school staff can interact differently with the student. So in the behavior intervention plan, it talks about how staff can change school systems to better support that student, how staff can alter the environment to better help that student, what skills that need to be taught to that student, and how they're going to acknowledge the learning of those new skills for that. So they need to make sure that they're building in some kind of reinforcement system with that. So the behavior intervention plan is about how staff are going to change and adapt the educational world to help the student be successful. So the behavior intervention plan and modifications might be allowing a student to sit in a specific place in the classroom, providing a quiet place that's free of distractions for them to complete their work. It may be it's having two different desks, maybe a standing desk and a sitting desk. They might put in some kind of accommodations. Accommodations might be shortened assignments, helping them with taking their tests. It might be accessing a calculator when they're working on some kind of math, or working in small groups rather than whole group situations. It might be adaptation of curriculum and materials, such as pre-teaching skill sets, or study skills, or giving them test-taking skills. They also might look at social skills instruction to help the students' behavior and to be more socially appropriate. So they might look at teaching them how to advocate for themselves, or how to socially appropriately get attention from other people, or they might teach them how to problem solve. So there's lots of different social skills instructions that can be included in the behavior intervention plan. It might be individual or group counseling. Maybe they're meeting with a specialist to when I say counseling, what I really mean is skill building. So they're meeting with somebody to teach those specific skill sets with them. The purpose of that behavior intervention plan is to address the behaviors that interfere with the student's ability to gain reasonable benefit from their learning environment. So it's about identifying, here's a barrier, and how do we help them overcome that barrier so that they can be successful in the classroom. The goal of that intervention plan is to make a student's challenging behaviors irrelevant, inefficient, or ineffective. So when we look at the behavior intervention plan, these are the different parts. The behavior intervention plan always starts with the student's strengths. A lot of times it can be challenging if all we're talking about is the student's negative behavior. So we want to make sure we're writing this behavior plan from a strengths perspective, and we're building the student's strengths. So again, as parents, you're going to know what their students' strengths are, and you're going to be able to help the school navigate that student strength area. The student strength area is things they like, things they enjoy, things they're good at. The mere fact that the parent showed up to the behavior or IEP meeting is a huge strength. I've had many times where getting parents to show up was a struggle. The mere fact they have a parent there is a huge strength. So it's how do we capitalize and build on those strengths? It'll include that summary statement from the FBA. It'll have a detailed description of the behavior so that we're all on the same page. It'll have a bunch of interventions and strategies that need to match the function of that. And then it'll have a goal statement of what we're trying to do, and it should have criteria so we know when we met that goal with that. And it should have a crisis plan if needed with that. And then again, our contextual fit. So this is what a simple or basic behavior intervention plan might look like. It starts with that sources of information. Where do we get the information from? Has that strength-based profile. It has our hypothesis or summary statement that comes straight from our FBA. And then it has the strategies broken up into 4 columns. And so we're going to look at that first column of setting event strategies. That setting event strategies It might be, how do we minimize what what the student is bringing in from the outside world? So that it's really about how do we get them focused on education. So an example might be in the home environment, there's usually less structure. It's normal to have less structure in a home environment. It's normal to have high structure in the school environment. So it might be, how do we help them make a mental transition from a low structure environment to a high structure environment, to get them thinking about school and to stop thinking about video games or hanging out with their friends, to make that mental transition. So your setting events are all about how do we prepare them mentally for that school and that school environment. Your antecedent strategies, which is the next column, is all about how do we prevent the student from being triggered, or that antecedent. How do we make it so an example might be the teacher saying, you need to do this worksheet, to a teacher saying, here's 3 worksheets, which one would you like to do? So that antecedent strategy might be changing the voice or tone of the teacher from sounding directive to offering choices with them. And so you're looking at those antecedent strategies. Your behavior strategies are going to be, what new skills are we going to teach this student? Who's going to teach them? How often are they going to learn these skills? And then your last column, the reinforcement strategies. This is all going to be about how do we reinforce them. And that means, how are we going to get them to continue to use the new skills that we've taught? We've taught them new skills. We want to make sure that they use those new skills. And that's where that strength-based profile is going to become very important, because you can use that strength-based profile to develop those reinforcement strategies. So what is the role of the student's parents in the behavior intervention plan? Parents need to be included in the development of these strategies and interventions in that behavior intervention plan with that. And then also with that, we should be able to look at, how do I implement this behavior plan in the home environment based on the setting events and the antecedents and the behavior and consequences. What can I do in the home environment to support that school? The research has shown that if you can put these behavioral strategies in the home environment, and they're also in the school environment, that reduces that 1 month time period to changing or correcting that behavior. It goes a lot faster when the home and school are working in the same direction with that. And so sometimes I've written behavior programs where students can get points at home that they bring in school, and they can access that in the school environment. Or sometimes it be done the other way, where the reward is at home in the form of video game time or TV time, but they earn the points at school. So there are lots of different ways to build that connection and that relationship between the parent and the home environment. So now we're going to talk a little bit more about managing behaviors in that home environment. And with this, a lot of this information comes from Kiki McGough, and I'm going to share a little bit of information from her. So the one thing that's important to know is that we cannot control other people's behavior. We can influence other people's behavior, but we cannot control their behavior. A lot of times when I talk with parents, sometimes they feel like, oh, I must be a horrible parent because my child's engaged in this behavior. As the parent, you're not responsible for that child's behavior, because you can't control that behavior. You can influence and help guide them, but ultimately the student needs to be responsible for that behavior and not the parent. So don't see this as when you're doing a functional behavior, don't see it as a reflection on your parenting skills. Just see it as a place where the student needs different skills that maybe need to be taught in a different environment or a different setting, and increase their toolkit with that. So I just want to make sure you understand, as from the parent perspective, that doesn't mean you're a bad parent if your child is having behavior problems in school. So this is Kiki McGough. Kiki McGough works for Peak Parent Center. In the past, she has worked for the Colorado Department of Education, and she also works for the Association of Positive Behavior Supports. If you go to PEP conference, which is Parents Encouraging Parents, she shares these 10 top things parents can do to engage students and with their behaviors. I know this is kind of small, so I will make sure we include her top 10 list in our handouts or connected to this particular PowerPoint so you can go through and establish that. She has great, phenomenal suggestions. And so I just wanted to make sure you had access to those suggestions. When looking at behavior in the home environment, you want to look at different routines that you go through in the home environment. This is called a routine analysis, and this is something that the parent can do in that home environment. So the routine analysis would be listing all the activities, such as getting ready for school, getting in the car, going into the school building, um, watching TV, homework, dinner time, bedtime. And so you put all these routines down, and then you would rate these routines on the likelihood of the problem on a scale from 1 to 6. With that, 1 being, it's not so much a problem, 6 is a major problem. So that way it helps you to very much narrow down or very much define what behaviors we need to focus on or what behaviors we need to prioritize. And then for those ones that are a 6, then you could go to that specific problem behavior. And this is where we would create or develop an operational definition. And we're going to look at putting in some reinforcement with that. So you can also take this routine analysis, and again, this is Kiki McGough's work and adaptation. You could put it into a home behavior matrix. And the home behavior matrix talks about these different environments: getting up in the morning, getting to school, cleaning up time, time to relax. And you want to put in here, what are the expectations in these environments? So what are your expectations around getting up in the morning? Are going to school with that. And so this just gives you a chance to have a conversation with your child or with your student, and so that you can put all these expectations on paper. I've used this, I have 3 children, and I've used this with my own children. And it's very helpful because it is very clear what those expectations are. And if they're not meeting expectations, then instead of them having a dad lecture, and my kids will tell you I have great dad lectures, you can go back to this matrix and just review those expectations and what are we looking for with that. And so when we're building these expectations, though, when you're putting everything on here, it's not just for the students to follow. Anything that is put on this matrix, parents need to model these behaviors for the student with that. And so then it becomes kind of a two-way agreement where parents can hold children accountable and children can hold parents accountable because they're modeling these behaviors. This is just how we agree to interact with each other. And this content all going to be customized to your household, your house rules, your culture. And so you're going to make it look like what you need to for your environment. And so what we can include with our handout is a blank matrix that you can have to fill out as well. This is an example of a matrix that was done for a older student. This is a student who went off to college and was returning home, and the parents like, oh, I know I'm going to have battles in these areas with my student coming home from college. And so they put together one about trash, about bathroom usage, and in here they also included about laundry and what the laundry expectations are. So you can build these kind of home matrices. Another thing that comes from Kiki McGough, and she talks about this family agreement document, where it's about having a child and parent maybe sit down, or they could do this individually, and they can say, I know I drive you crazy when, and they would list those behaviors, and I'm willing to do something different if you will do something different. So this kind of becomes your negotiation piece or your negotiation tool, where you can kind of come to some kind of agreement with that. So for my children, it might be, I know I drive you crazy when dad gives really long lectures with that. And so maybe dad will be willing to give a short lecture if the student maybe demonstrates that they understand what I'm talking about. And so it becomes that negotiation piece that you can go through with that. So just another tool that you can use. This is also comes from Kiki McGough, and she designed this kind of behavior plan template for parents. And so you would take the school behavior intervention plan that we talked about, and you could have the school help you or reformat it into this style so that you could work at it in the home environment. So she kind of simplifies it a little bit, and she includes the setting events and the triggers in one area, where at the school they're going to have it in 2 separate areas with that. our operational definition and the consequences, just so that in the home environment, you know specifically kind of what they're working on and the behaviors they're targeting. And then in the middle, that yellow box is what is the function or what the benefit for that. In the lower part, this is what parents can do in the home environment to connect back to that school environment with that. So again, this is just another template that you could kind of take and use, and you could have the school people help you walk through this and fill this out so that you can put this into the home environment and have something functional for that home environment. Descriptive feedback can be the most powerful technique for integrating positive change in a child's behavior. And that's just non-judgmental observation of the behavior and providing feedback. So when we say non-judgmental, it means I'm not going to label it as good or bad. I'm not going to label it as right or wrong. I'm not going to put an opinion to it. I'm just going to say, I noticed, and then factually state what happened and provide that feedback in a very factual manner, free of emotions or interpretations or right or wrong. And so even if you take nothing else from kind of this webinar, if you do this one thing of providing descriptive feedback, that'll be greatly helpful, and keep it factual and take out the emotional piece of that. I'm happy to answer questions. You can email me. I've got my email address on the screen, and I've got my CDE cell phone on the screen. So feel free to reach out and ask questions or send me an email, and I will do the best I can to provide you with good information or point you in a positive direction. Any questions?
Thank you, Bill. I don't think we have any at this time. Do you want to talk about that Word document and those links to the website that you were mentioning to me earlier?
Yes. So what I'll do is I'll take the presentation and I'll take the handouts and I'll put them all in a Google Drive, and I'll send that Google Drive link to Pam, and then Pam can get that Google Drive out so that everybody has access to the handouts and to the PowerPoint presentation that is here. So I want to make sure you have access to all those different materials. And so I'll make sure that gets included with that. Another resource I have is I have another the Moodle class, which is kind of an online class. It's a self-paced, self-guided Moodle class, but it's on what is called PPRA, which is for protection of individuals against restraint and seclusion. And the title does not match the acronym because they changed the title, but they didn't change the acronym. But this is just a course that has 12 different modules where you can learn about what are the regulations around restraint, what are the regulations around seclusion. And we have a parent version of that where you can pop in and you can just learn that information and learn that content. And the reason we want to provide all this information is that we want to really educate parents, and so the parents can be awesome advocates for their students. So we want you to come in and advocate and share with the school environment. And the more informed the parent is, the better collaboration you can have in that school environment. And so I will also include in that information a link to these Moodle courses, and we will get you that. So if you want to go in and take a look at that, then parents are welcome to do that.
Thank you so much.
Mm-hmm.
Again, my apologies for the technical difficulties. I will be sending out the recording right after this webinar, and it will also be posted on our Peak Parent Center website under recorded webinars. And you will receive a training evaluation. So if you could please just take a minute or two to fill that out. Peak is always trying and strives to improve our services. If you have any other questions, you can contact Bill at his email or his cell phone, or you can contact any parent advisor at Peak at www.peakparent.org, 719-531-9400, or email at parentadvisor@peakparent.org. Please check our website to register for our upcoming trainings, webinars, and events. And we hope to see you September 12th for the second in our behavior series, overview of removals from school, including manifestation, determination, review. So again, thank you all and have a great day.